Hello, ladies and gents. Welcome back to another discussion about our mental health. So, do you know the difference between anxiety and fear? So, fear is a response to a perceived threat, something that might happen. However, anxiety is just worrying about something that may never happen, has never happened, but you just keep worrying about it. That's anxiety. So today I'll be discussing about anxiety disorders. But before I go on, I want to appreciate everyone who follows our videos, who likes, watches to the end, and even those who share the videos. I want to especially appreciate Chineye, Promise, Hope, Waneka, and Chioma. I want to especially appreciate my Odogu Parara, Alfred, who always shares my videos. Thank you very much. I really appreciate all of you guys. You know, you understand the assignment and you're running with it. Thank you very much. An anxiety disorder is actually a mental illness. And for people who experience anxiety disorders, accepting change, and uncertainty is very challenging for them. It's quite difficult for them. It comes with feelings of anxiety, distress, and a lot of other disturbances. So there are different types of anxiety disorders. You have the generalized anxiety disorder. With the generalized anxiety disorder, this person just keeps worrying about everything. You know, will it go well? Will it not go well? Will this happen? Will this not happen? So, life is filled with uncertainty. You're going out in the morning, you're never there's no certainty that you will come back, and you will not have issues out there. However, you still go out. But with people with anxiety disorders, so they kind of begin to see everything. They see and think about everything that can go wrong. And this kind of incapacitates them and affects their ability to be able to perform their daily functions properly as should be. You also have social anxiety. Social anxiety is this general anxiety around being with people in social context. This person feels very uncomfortable being amongst other people, especially people who they are not very familiar with. Um, they probably feel they don't fit in or they'll never fit in, or people will judge them harshly and those kind of things. So you have panic attack. Panic attack is, sudden, instant fear. In some cases, it can be very unexplainable. They might not even be able to explain what has happened or why the person is in such a state. But this person gets into this sudden, instant fear that kind of cripples them or cripples their ability to continue their tasks if they were doing something. That's panic attack. And then you have phobias. Phobias are particularly fear of specific objects or places or situations. And when this kind of fear comes, it kind of cripples their ability to be in that situation or to uh, um, be able to be in the situation or fear of that particular object, managing that object or something like that. So there are different kinds of phobias. I know that we hear phobia a lot. You have phobia for heights, you have phobia for dark places or darkness, you have phobia for open air spaces, for being in open air spaces, you have phobia for water. There are lots of phobias, and so some people who have these specific phobias find themselves in very difficult situations, very anxious of such situations. So you have people who have phobia for animals, for specific animals. Some have phobia for cats, dogs, all those kind of things. Separation anxiety. Separation anxiety is a general anxiety around being separated from loved ones or familiar people that you're familiar with. Separation anxiety um, can be can come up or can be triggered as a result of some traumatic situations. Example, someone who has been kidnapped, or someone whose child has been kidnapped. So you see, when they have to be away from their loved ones, when they have to be away from their family or from people that they are supposed to be taking care of or people who are taking care of them, it kind of raises a lot of anxiety in them. However, it's important to note that separation anxiety in younger children, infants, toddlers, is typical, it's normal, it's part of their developmental stages. But in adults and older children, it's not normal. So there's also selective mutism. Selective mutism is when a person finds it difficult to speak in certain situations, maybe in front of a crowd, maybe in front of people they are not familiar with, you know. But when they are with people they are familiar with, people like family, close family, friends, they are okay to, they speak well, they are okay, they don't even stutter or stammer. However, when they are in the midst of people who they are not familiar with, they might become mute or maybe they begin to stammer. That's selective mutism. So I know you'll be wondering, what is the cause of this? I mean, you have a lot of these issues and people don't know what's the cause, how did it happen, what's triggering it. So typically, there are no clear cut causes to say, oh, it's because of this. Yeah, in some cases you can link it to some things, but it's important to note that there's always this link between anxiety disorder and hereditary. So you check your genes, check people who are older, check the generations past. If there's anybody who has this kind of situation, who has experienced something like this or something similar, you will also have hormonal imbalance. And imbalance in chemicals in the brain can also trigger anxiety disorders. You also have then environmental factors. So now looking at environmental factors, trauma. Trauma is a typical situation that can trigger anxiety disorder. Remember, I mentioned when it came to separation disorder that maybe in a case where someone who has experienced kidnap situation might experience separation disorder, or their children might experience separation disorder, depending on the scenario and how traumatic the situation was for the family. So these are things that can trigger um, anxiety disorder or even some other mental health illnesses, just like I mentioned with depression disorders. Trauma is very, very is something that we need to pay attention. It's very, very important when it comes to our mental health. And so you note that these are some ways in which trauma can affect our mental health. So how can you know if this person is experiencing or any of these anxiety disorders? There will be irritability, constant irritability, panic, fear. Person's always scared about one thing or the other, scared about situations. I mentioned panic. You can have muscle tension, experiencing muscle tension, shivers, sweating. You can also experience difficulty going to sleep or staying asleep. Um, Palpitations, your heart might begin to palpitate. So these are some signs that maybe something is not right here. You're getting anxious, and it's it's getting worse. So when will we say that, because we all get anxious, and yes, some people experience anxiety disorders, some of these anxiety issues, and they are able to function. But when is it a problem? It's a problem when, one, you find out that you're not able to go about your daily activity. You're not able to be as productive as you used to be whenever you have this experience, whenever you're having these episodes. And two, you realize that your reaction to the situation is outrageous compared to the situation. Example, someone who has a phobia for dogs. The person sees a dog and the person begins to shiver, scared, you know, your heart begins to palpitate. You you just realize that it's not even as if the dog is even coming after you. Probably you just see a dog passing and you just are having all these reactions. So you notice that your reaction is way out of proportion to the situation on ground. So is it possible to manage this situation on your own? Yes, it's possible. You know, to some extent it's possible. When the situation is mild, it's possible. You can manage it with deep breathing, you can try exercising, you can practice mindfulness is trying to be conscious of the moment where you are, what you're doing. You can also um try to identify if it's like a scenario, a situation that seems so ambiguous as getting you anxious. You can also try like breaking down the situation, or breaking down the tasks, or breaking down the activities into smaller tasks, taking it step by step. For example, someone who gets anxious in social context, or who experiences um, mutism, selective mutism, you can start with practicing talking. You can start in front of your mirror, practice as if you're talking to the strange people. This can help, and then practice breathing exercise to try to calm yourself down in case you're experiencing palpitations. So these are some things you can practice to help you manage the situation on your own. And as much as possible, if it's working for you, and fine, you keep getting better. However, there are situations where you try and you find out that it's not working, then you need to get help. So I said get help, get help. What kind of help can you get? There are medications and there's psychotherapy. So like I mentioned with depressive disorders, psychotherapy and medication goes hand in hand. And sometimes if it's a mild situation, then you can even do only psychotherapy and you'll be fine, and you'll be able to manage yourself. But if the situation is very serious, and depending on assessment, then you also need to take meds in addition to psychotherapy. And so that's why it's important for you to seek help early. The earlier you seek help, the better. You know that's it's very, very important. It's very key. So how can psychotherapy help in this situation? Psychotherapy will help you to confront, identify first, identify and confront those thought patterns that exacerbate this anxiety. So you're able to understand how this happens, and how to address these thought patterns. That's very, very key. So psychotherapy helps you to also develop the skills, the necessary skills that you need to manage these episodes, like the relaxation skills, practicing mindfulness. It also helps you to be able to develop skills to sustain your relationships despite, this disorder that you also have to manage too. The challenge is that with mental illness, sustaining relationships can be very difficult, very, very difficult. And relationships, coincidentally or ironically, is very, very important. Very good relationships, your social connections are very, very key with managing mental health issues. And so that is why in any time I talk about psychotherapy, I also mention that psychotherapy helps you to be able to develop skills to manage your relationships, because if you can't manage these relationships well, you lose them, and you need them. They are very, very critical. They are very, very crucial. So these are some of the things that psychotherapy will help you work around. I hope this video has helped you. If it has made any sense and any meaning to you, I hope you share it with people around you, so that you can help somebody out there. Share it on your profiles and all that, so everybody will see it. And thank you in advance for sharing. Have a wonderful, wonderful month and week ahead.